from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. Well, if you knew something could cut your risk of death by 70% for older women, wouldn't you want to know about it? Well, we have Baptist Health cardiologist Dr. Scott Davis here to explain several recent study findings, and these are pretty interesting. Dr. Davis, thanks for being here. I know you're always into the most recent studies and the latest information. When someone says, if I could cut your increase or your risk of death by 70% if you're an older woman, wouldn't you want to listen to something like that?
It's pretty sobering stuff. Look, women and heart disease have been on the front burner for the American Heart Association now for years. We're on the heels of, Heart Month in February, and we're transitioning into this Go Red for Women campaign that the Heart Association has. So we constantly want to message women and the importance of understanding risk if you're a woman for heart disease. There's been a lot of studies that show that maybe only 20% of women really appreciate the significance of heart disease risk, especially in their older years. And yet more women will die from heart disease than from diseases 2 through 5 combined. And so we say this often, like, for all of the research and emphasis that our colleagues over at Susan Komen and Race for the Cure and breast cancer awareness, and it's super important, don't get me wrong. More women will die from heart disease than from breast cancer by a long shot. So there are a number of things to emphasize along the way, no matter where you are in any stage of your life as a woman, to pay attention to these risks that are out there. For example, if you were pregnant and had severe preeclampsia, so if you had hypertension during your pregnancy, you have a 7-fold increased risk of having heart disease or having hypertension after your pregnancy. So if you were a woman and had hypertension during pregnancy, you have an increased risk of having hypertension well after you've delivered. So oftentimes, like, they'll go see the doctor, get your blood pressure checked, and then I've delivered, so I don't have to check anymore. Pay attention, because you still are at increased risk for developing hypertension down the road. Same thing for exercise. We now have a 4-year study that shows in women there is some 70% reduction in all-cause mortality related to vigorous exercise, doing brisk walking. And so we've always known, like we've said, look, get off the couch, right? We've always known that exercise has an inverse relationship to improving your life expectancy. But this data is the most robust that we've had so far, specifically for women. So it's very encouraging stuff that's coming out on all spectrums. Women and breast cancer.
The treatments. What about some of that?
So it's important to understand that certain treatments, look, we would never want to scare anybody about breast cancer treatment. We never want to discourage it, obviously, but you need to have a dialogue with your doctor about the potential risks. The HER2 therapies that are geared towards certain, receptor positive therapies can be cardiotoxic to the heart. Oftentimes it's temporary, but then there's sometimes when it can be permanent. So, pay attention to heart failure symptoms while you're getting breast cancer. And then another sobering statistic, breast cancer survivors after the age of 65 still have a much higher chance of dying from heart disease than from breast cancer itself.
Now, blood clots in the leg, is that something that one of the things that people will get during some breast cancer treatments?
So with either induction of chemotherapy or right after it, that you can develop a blood clot in the leg, and there's a 2-fold increase in mortality in that setting versus just getting a blood clot in the leg. So again, these are things to be aware of, so that, look, breast cancer and heart disease are not just independent in a vacuum. They have a lot. Look, there's a lot of risks that intersect there, like genetics and smoking and other diet. And so by addressing one, you can also affect the other. Absolutely.
Wonderful. Well, great research always to keep in mind as you are finding out what is the best treatment option for you in any facet of health. Dr. Davis, thanks for coming in this morning. We'll see you next time.